Were we prepared for this? No, we were not prepared for this at all.
The outbreak of the coronavirus, or COVID-19, has infected more than 4 million people globally. The virus, originated in Wuhan, China in late 2019, spread to over 177 countries. In a matter of months, over 318,000 people died. The virus eventually spread to the United States in late January. The first confirmed case was a man in Washington state. In mid-March, the World Health Organization characterized coronavirus as a global pandemic.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction.
A few days later, Trump declared a national emergency.
I'm also asking every hospital in this country to activate its emergency preparedness plan so that they can meet the needs of Americans everywhere.
He issued a travel ban for certain hard-hit European countries.
Me, my mother, and my brother were all in America at the time, but my father was in the UK, so he was stuck in the UK for about 9 weeks.
But the US government was late. Studies from Columbia University show that if we had implemented measures earlier, many cases could have been prevented. Schools shut down and shelter-in-place orders were issued, but this was delayed for many states.
Up until it was apparently obvious, the administration totally disregarded the seriousness of this virus. There was a lot of waiting to the last minute in our country before it was very obvious that this was a crisis for them to do anything.
The US quickly became the country with the most coronavirus cases in late March. The cases kept increasing as health professionals urged the public to help flatten the curve. Life changed for people in quarantine, and the CDC advised people to stay at home and only go out for essentials while maintaining proper social distancing.
Something that scares me is that seeing so many people not social distancing, I feel like it's sort of kind of selfish for people to go outside and hang out with friends while everyone's trying to stay inside and stay healthy.
I'm so over this. It's been 10 weeks. I just remember how excited we were for school to be closed for 3 weeks, but none of us really expected that it would go this long.
I mean, it was fun for the first a week or two, but it was I was quick to realize that you definitely get bored and lonely with so much unstructured time.
I take my dog on a lot of walks because that's the only time I get to go out. I have to be especially careful because my mom is in remission, so she is slightly immunocompromised. I definitely could have it worse, but it has been really hard being at home for so long, not being able to see my friends.
My mom hasn't been outside in 2 months. I went to Safeway the other day, and the ground, it had one-way stickers so that it's not congested in the aisles. In the beginning stages of when we started quarantine, there was no flour or pasta or bread.
I definitely think that there's a lot of fear because no one really knows how long this is going to last or how dangerous this could be. But I do think there are some people who have channeled this fear into racism towards Asian Americans. And we see this as a pattern in our history. When 9/11 happened, Islamophobia increased tremendously. I think that our president has also encouraged this racism by calling it the Chinese virus.
When I was working in March before we closed, there was a few instances of people saying, hey, I don't want that kid touching my drink, blah, 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 things like that. It was just kind of casual, but it was aimed at me because I look kind of Asian. No, I'm half Asian.
Along with social impacts, the coronavirus has drastic effects on the American economy.
Honestly, I think that the economy would not be hurting as much if we had taken more precautions earlier instead of waiting to the last minute, denying the seriousness of it, and just overall being underprepared as an administration.
You know, obviously from an epidemiology standpoint, we want to close restaurants and close public spaces, but from an economic standpoint, we're going to see massive shocks to the economy if this continues.
As a response to this, the government issued $1,200 stimulus checks to every taxpayer.
The stimulus checks were really effective because, you know, Americans need money right now. The Federal Reserve's policies, we've never seen anything like that ever before. Like zero interest rates, like mass amounts of cash just flooding into the money supply. In normal economic crisis, stimulus checks would be to spur further spending. So economists initially were surprised that we aren't seeing an increase in purchases of automobiles and appliances. But when you think about it, like with a $1,200 check, that's not only not enough money, but that's not anyone's priority to buy right now. So we're not seeing the stimulating effect that was intended. Another policy that's really working is the extension of unemployment benefits. And it's somewhat perverse because in some states, unemployment is actually, the $600 a week you get is actually higher than people's working wages. So it's really provided a good lifeline, but it's also almost certainly not enough money.
$1,000 is not going to solve like the fact that you had a horrible response at the beginning and the unemployment rate is now at 15% and people aren't able to afford care. This really shows the flaws in our American system as a whole. Like the costs for testing, like people who are uncovered because Medicare is not available to everyone in this country, which is ridiculous. Anything can be taken away from this. Like I hope we learn from how unprepared we are, and I really don't think we're going to see any major policy changes even after we go back to normal, and that just like really, really hurts.
There is hope in all the chaos that coronavirus has caused. People are finding ways to support their community and spend more time with family. Global air pollution has decreased. With all this free time, it's actually allowed me to reconnect with a lot of people I haven't talked to in a while.
Like I'm closer to my family than like ever. So that's really nice. I mean, you know, like came out to my parents because I was in quarantine and I had nothing else to do. So
some colleges are opening in the fall. Specifically my college, we plan on going back in the fall. So that has given me some hope that we will return to normal.
Like just seeing like my friends and other people in the community like still contacting each other even though we have like all these precautions we have to take, and like people are doing really amazing, great things, and like that really gives me hope for humanity as a whole.
Breaking news this morning on the search for a coronavirus vaccine. The results of one small study on humans are now in, and they appear to be encouraging.
A company called Moderna in the sprint for the vaccine, they've taken a little bit of a lead here. And this is good news because we're getting step forwards in the vaccine process here, but they still have 2 more phases to go through. They'll do a phase 2, which is about 600 people, and then they'll do the big phase 3. They think they'll start that in July. That's the one that's going to give us a lot of answers. If they get through that, then we'll get the vaccine. Keeping our fingers crossed. We're talking sometime after the new year, I think, is when we'll get it. Maybe before, if things fall into place really well.
A vaccine is our only hope for things to be normal again. Scientists say it'll take 12 to 18 months to bring it to market. So in the meantime, all we can do is take safety measures and be patient.